Bookings for the nation's 23rd round of vaccinations opened on Wednesday, offering shots of all 4 COVID vaccines authorized in Taiwan.
Administering will begin next Monday, and health officials urged the public to get the vaccine to be protected against the disease. And so far, 99% of people aged between 18 and 29 have already received their first shot of COVID vaccine in Taiwan.
We're at New Taipei's Sanchong Civil Sports Center, where Pfizer is on offer as a first, second, or third shot. People have flocked here to get their vaccine.
I've looked at their effectiveness and it seems that Moderna is the best, but it's hard to find, so I chose Pfizer instead, which I think is also okay, so I came for my shot. At the beginning, I was considering Moderna and Pfizer. In the end, I went with Pfizer. I'll get whatever my kid booked me in for.
People are getting their shots to be protected against COVID, and the share of people who have received a booster is gradually going up ahead of the government's plans to relax border controls for international travelers. The CECC also announced that bookings for the 23rd round of vaccinations opened on Wednesday. Older adults headed to local borough offices to book an appointment early in the morning. So far, 24.19% of all available Moderna doses have been booked, leaving just 580,000 slots. Meanwhile, 13% of Pfizer doses have been booked, leaving 573,000 doses available. About 8% of Medigen and 3.98% of AstraZeneca bookings are gone, leaving 116,000 and 22,000 doses available respectively. The booking system closes on Friday at noon, with administration to start on February 21st.
Every day, we must call on people who haven't been vaccinated or who are not fully vaccinated to get their shots as soon as possible. Vaccines are the best way to prevent severe symptoms and even death.
The CECC urged members of the public to get their COVID shots. Currently, 99.9% of people in Taiwan aged 18 to 29 have received at least one shot of a COVID vaccine. A former doctor suggests that this demographic should be the first to enjoy fewer COVID restrictions regarding international travel.
Say, if you're going to let people travel about, you start with the safest people, those with the lowest risk. Even if they are not vaccinated, most of the time they'd only get mild symptoms from Omicron, even milder when they are vaccinated. There are still a lot of breakthrough infections. If you want to go abroad, it's something worth observing.
Vaccines can prevent severe symptoms, but do not grant absolute immunity against COVID. The CECC says vaccine coverage is not the only deciding factor to look at to lift travel restrictions. It's looking like quarantine-free vacations overseas are still far in the horizon.